Okay, what we want to talk about today is kind of how our immune system works. And the other thing is a little bit about the COVID-19. There's a lot of misinformation out there. There's things we need to be concerned about, but there's an awful lot of things that have been blown way out of proportion. I'd like to kind of explain how that all works. So I'd like to get going right into our immune system. This is information that's been around for 85 years. Believe it or not, they're still using much of the information that was developed in the around 1915. It's been fine-tuned a little bit, and now we're getting a little bit more into the bioengineering aspect of it, but it still works the same. And to start off with, there's stressors in our world. They can be physical, and some of the physical ones would be temperature, gravity, etc. Emotional stress, which is a huge one nowadays. We could go on and on about that. We also have injuries, bacteria, viruses, other poisons and toxins. And so when something enters our body through your nostrils, skin, ears, gut, whatever it might be, it activates what's called neuroimmune response. And our immune system is broken down into two parts. We have the adaptive immunity and then the immediate immunity. And these are two different things. The immediate immunity is thinking about you have kids or grandkids, and they have their Nerf guns hiding in a room, and you're the virus or the bacteria or mold or whatever it might be, and you're walking in, and the lights go on, and they're all pointed to you, and you get pelted with all these little Nerf pellets. And so these are looking at non-specific agents. They see you as the enemy and they want to attack you. So these little fighters are really called non-specific agents. They're little warriors that they're just there. They'll attack anything that seems a threat to the system. And this occurs all the time. When we get a virus or a bacteria, this normally lasts about 72 hours. Again, it's non-specific and it's relatively quick. Now, that innate system interacts with the adaptive immune system. And the adaptive immune system is a much more complex. And I'm trying to simplify this because the researchers, they could go into hours and hours on this. We're trying to make this somewhat simple. So it interacts with the adaptive system. And the adaptive system is what develops the antibodies or the antigens. Okay. Now that innate immune system, that Nerf war, again, lasts for about 72 hours, then the adaptive immune system kicks over. And that really doesn't kick in to about 3 or 4 days. And that's going to work on the long-term immunity. So this is what's taught in medical schools. It's basically a 2-step process. And as long as you can get your antibodies or your antigens built up, they consider it a win. It's also the basic premise behind the vaccine theory. Okay, for example, when I was a child, I was exposed to chickenpox. Back then, we all had measles, mumps, chickenpox, etc. Okay, so I developed an innate immune response. This is when I developed a fever, the pox on my body. And then after a few days, it moved into this adaptive immune system and started creating a natural specific antibodies for the virus. I healed, and I've never been infected by chickenpox again. That's why when you have it, this adaptive system creates the antibodies so we can't get it again. Now, interesting, I wanted to talk about chickenpox for a moment because, as we know, shingles is a big, big problem nowadays. And one of the interesting theories behind this is that when kids used to get chickenpox and now they have the vaccine, so they don't. And so when adults are in their 40s and 50s, normally they would have been around these kids that had chickenpox, which would be a natural booster. Now they have not gotten them. So now shingles have become much more common in the last 20 years or so. So it's a very, very interesting process. And I always tell people, if you notice a child that has chickenpox, give me a call. I'll come and read a book to them because I've treated a lot of patients with shingles and it's not fun at all, okay? So the vaccine theory is that it's bad to get a virus. And I know viruses can kill people, as we've seen with the COVID-19, as well as regular flus. And we're not here to debate that, or we're not here to debate the pros and cons about vaccinations. Okay. But we want to understand that mechanism, that when you have a vaccine, it bypasses the natural immunity by jumping right to the adaptive process to try to kick the antigen response. Okay. And the short circuiting of the system in theory works out okay. In the long run, it doesn't work out as well. They're finding that many of these kids that have had these vaccines, the immunity doesn't last as long, so they have to get more boosters. Where it used to be, you had the disease and you would have lifelong immunity behind them. Okay. The other thing is that we miss the fact that we are a complete biological system. Okay. Our brain controls everything. Okay. Enormous amount of information is interlinked, and it communicates from brain to cell to other cell, et cetera, both electrical and chemical. We are, for the most part, electrical beings. If you ever have an EKG or an EMG or something, it measures the electrical activity of that particular part of the body. And so we're basically big batteries, but we're much more than the sum of the parts, okay? So when you skip the innate immune system and introduce this fake or attenuated virus through injection, they found that it doesn't work so well, okay? And they need to use middlemen to kickstart it, and that's why you read about aluminum and mercury and thimerosal and some of the other adjuvants having to be in these viruses to actually make it work better. In the area of ADHD and some of the learning disabilities, there's been big discussions on these additives. And again, but we're not going to get in that today. Okay. It turns out that there's a whole lot more interaction in the communication process between the innate immune system, again, that nerve war, and the adaptive system. And then another system called the interferon system that actually works between that. And some of the countries that dealt very significantly with the SARS virus, which is actually another coronavirus, they've done a lot of research on the interferon, and that's one of the ways that they're working at doing it. There was a couple of researchers in United Kingdom that did research, and they found that if they injected a rabbit with a virus, that rabbit was immune to similar viruses, not just the one that they gave it to. And that's why developing a natural immunity is so good for the body. Okay. Okay. So it's crucial for what we're seeing in the world right now, because without this natural feedback and this communication, the adaptive immune system, in some cases, does not function as well and becomes down-regulated. And that's why you hear in the news, 12 months or 18 months to the vaccine. Some people that might be effective. Some people, they're going to get very sick or possibly die from it, just like the flu vaccine, and others can be helped, okay? So the current thinking is that besides just the viruses, we have about 10 trillion viruses in our body at any one time. That's about 10 times as much as a bacteria. For every one human cell we have about at least 10 to 100 times as much bacteria and viruses. So viruses are a part of our body. And it's called our microbiome, which is in our gut, which accounts for about 70 to 90% of our immune system, is so important to the function in the immune system. That's why a lot of people have been asking, what kind of probiotics should I have? Well, there are so many different probiotics because there's so many different kinds of bacteria. And it really depends upon the person what probiotic is best. By all means, you want to get a multi-strain, and we'll get in that when we get into the application part. Okay, so we have all this bacteria and all these viruses living inside of us right now. It's called the virome, and the study has shown even when a person dies, that bacteria continues to live well. I know it's kind of gross, but it's just kind of amazing. Okay, the type and balance of the bacteria in your gut dictates your level of health. This is one reason why researchers refer to your gut as the second brain. And now they know that there's neurological communication between the gut and your brain as well. Many of the chemicals that your brain needs are synthesized in your gut and transferred up to your brain. This can be tested with stool samples, so if people need it, these tests are now available. Okay, so now in addition to all this, we have our master neural control system. I said the brain, which is composed of the brain and nerves, linking your brain to everything else. And we talk about your gut being the second brain. There's actually as many nerve cells in your gut nervous system than there is in your brain or in your spinal cord. So it's so very, very important. It's controlled chemically by this electrical system. And that means that your brain needs what you put through your gut to create the chemistry to operate. So what we eat becomes very, very important, not just to your gut, but to your brain as well. And sometime we'll go into, we'll have another webinar on brain chemistry and how it relates to our gut and microbiome. Okay. So your brain and your gut talk to each other constantly. It's kind of like a couple of teenagers on a cell phone, okay? It is just on all the time. You don't want to see the data charge for that, okay? Things that can affect your microbiome can cause neuroinflammation. That's inflammation in your brain, and other diseases as well. Alzheimer's, Parkinson's, these are all neurodegenerative, and inflammation is a key part of that. One of the critical points to understand is because all the systems of the body must communicate. So often in medicine, we want to specialize and we have this specialty working with this one, this specialty over here and over here. And sometimes it's very easy because it's so passionate about the area that they're focusing on that the body works as a whole. And one cell communicates with other cells. And that's one of the reasons that the interferon system, the innate immune system, the adaptive immune system, all must work together. And okay, so we used to think that you are what your genes said you are. You heard that they used to say that chimpanzee was only 4% different DNA than what we are. Well, that's okay because a roundworm is just about the same. They used to think that we had hundreds of thousands of genes. And when they did the Human Genome Project back in the 70s and further, they actually found that we have about 24 to 26,000 genes. And so we're not that much different than a chimpanzee or an ape or a roundworm, but that really doesn't make a difference because it's the epigenetics that makes us who we are, okay? So 98% of our genome, our genes, are made of RNA that we can actually turn on and off through methylation. It's a study of what's called bioinformatics. And so 98% of this, we can turn on or off the genetic expression, okay? And we'll touch a little bit on that later also. It's amazing how our body, if left to perform uninterrupted, can have this beautiful choreographed response to stress. I like to think of it as you have an orchestra and you have the brain conducting and all these different parts are working in harmony with one another. When the body's doing that, it works best at fighting infection, no matter what kind it is. One of the things that is happening nowadays is people are fearful. They're scared. We have so much this modeling going on. And I heard a good quote yesterday, and it said that no model is right, but some can be useful. I thought that was a really good comment because they're coming up with numbers that 100,000, 200,000, 2.5 million, these are simply models, okay? Nobody knows how many people are going to die of COVID-19, just like nobody knows how many people are going to die of the flu. Last year, about 40,000 people died of the flu, and they say about 41 million people had it. So they have models for the influenza, they have models for heart disease, they have models for everything, but bottom line is nobody has that number, even though the news agencies like to report it, okay? There's a book that I'm almost finished. It's by Daniel Kahneman. It's called Think Fast, Think Slow. He's a researcher. He won one of the Nobel Prize recipients. And it talks about our intuition is our brain one. And our slow thinking, our analysis is brain two. So this really applies to what's been going on with the COVID-19. So one thing to remember is that things that we easily imagine are judged more likely to happen. So when this information is in the news all the time, okay, it is in the forefront of people's mind. And so this is the fast thinking, the intuition. We hear it, we start believing it, okay? A quote he had is, I really like, is he says, a reliable way of making people believe in falsehood is frequent repetition, because familiarity is not, or probably is not easily distinguished from the truth. So repetition, repetition, repetition. You really can't. The first thing in probably half the news that you hear during the day is on the COVID-19. There is so much information out there, and a lot of it is true one day, a week later, it's not so true. I try to follow the stats from other countries, and it's very encouraging that countries like South Korea, Japan, et cetera, their numbers are going down. In fact, Japan has not had much numbers to begin with, but they believe that so much of this is from the SARS that they had, and that they were really ready for what's going on. So when you hear these numbers, I encourage you to just forget about that. Focus on yourself and your family. I believe that's going to be the most important thing. Okay. Another thing is intuition is mostly a blessing, but in some cases like this, it can be a curse. Okay. Intuition being your fast thinking or brain one. Okay. And the third thing is that threats often receive more attention than they deserve. Okay. And again, when I look at this, I'm still confounded because flu is a deadlier disease so far. Okay. But the media has just blown it out of proportion. Okay. I looked, and they're still tracking flu death rates, the CDC and the World Health Organization, but it's fallen back seat. And there's so many other epidemics out there that unfortunately are not being reported. So we have this innate immune system, we have the adaptive immune system, and this is how our body fights the pathogen, whether it be a bacteria, virus, et cetera, coming in our bodies. So the question is, what can you do for yourself or your family? First of all, I don't want to disagree with your state or local health departments, CDC, et cetera. There's some good things. Social distancing, I think, can be good. In fact, is good. Washing hands. I did some information a couple of weeks ago on washing hands, and I was thinking, well, very rarely do I go into a bathroom and see a man wash his hands correctly. Okay. And I happened to say this to my wife, Mary Claire, and she said, well, women do it all the time. It's okay. That really doesn't surprise me. So what happens is, if you, we all need to wash 20 or 30 seconds with soap. That's probably the best way of getting COVID under control. I was also reading that they say most people have to be within someone that has COVID-19 for 5 to 10 minutes, okay? So the likelihood of getting it, passing someone on the street, walking, whatever it might be, is very, 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 very slim. The stats right now, it's 1 person out of 75,000 people will get COVID, okay, worldwide, okay? So I know New York City is a little different, other cities are different, but that's actually what the numbers are, okay? Most information now is that masks still are not significant, even though they're huge right now, because it's something people can talk about. Okay, it's been shown that the virus can stay on stainless steel for about 24 hours. If you have a copper sink or pennies or something like that, it could stay on copper for about 4 hours. And cardboard 24 hours, stainless steel 2 to 3 days. Okay, so wiping down is very, very good. I did an Instagram thing the other day on the dirtiest places of our house, and you might want to think about changing your dishcloth out in the kitchen every day, and towels, and clean that sink up, because that's some of the worst that we have. Okay, now stress reduction. Stress is just huge. It is going to become a bigger problem the longer people are self-quarantining, self-confined, whatever it might be. I heard this yesterday. I thought, what a great idea. If you're in an area that's warmer, go for a picnic with somebody else. You can still have a picnic. You can still be 6 feet away, but you can close enough to talk, get out. The studies have shown that people that are in nature, in that green nature, it helps stress out so very, very much. If you're not able to do that, then I know you can download free pre-recorded sounds of nature, crickets in the forest, whatever it might be. If you're lucky enough to catch a sunrise or a sunset, that's very good emotionally for us as well. Okay, a person's faith is very important at all times. Now, people that so often when we have a situation like this, or I remember back at 9/11, faith becomes even more important. Okay, so if you struggle with your faith, email me. I'll be glad to send some links of some places that you can start helping you with your walk. Okay. Exercise. We're talking about walking. Exercise. Exercise is really, really important. It's so easy when people are home working or just home from school, whatever it might be, we just sit down. Okay. Get out and walk. If you don't want to walk outside, walk inside. Climb the stairs. Do some kind of resistance training. I don't care what it is, but we need to have physical activity. Physical activity helps our brain, helps our gut. Okay, two of the most important parts for our immune system. Okay, if you're an area that has sunshine, get out. Vitamin D is really important. And if you can't get the vitamin D from the sunshine, then take it orally as well. Okay. Talking about the self-containment, so many people have significant emotional conditions. So during self-containment or confinement, if these conditions become worse, please get some help. Most of the mental health facilities have telehealth services. If you have a friend that struggles with these, call them on a regular basis. It is so important for these people. Some of these can be toxic relationships, okay? Marriages that are not doing well right now is a huge stressor that's being reported. Domestic abuse, loneliness, mental illness, panic attacks, depression, despair, grief, even self-harm. So I know a lot of kids, a lot of teenagers deal with this. And so trying to check on them every once in a while, make sure they're doing okay. And if not, encourage them to get some help. Okay. Let's go on to eating. Okay, plenty of veggies and fruit. You probably all know that, especially veggies. Okay, we want at least 50% of your body weight in ounces of water a day, preferably a good filtered water, but any kind of water would be okay as long as you're getting enough fluid. We need fluid to keep our body functioning well. When you're sitting down a lot, we're not going to have a natural thirst. Most people don't. So keep pumping the water. Again, 50% of your body weight. I know it's a lot, but really try to do that. Different people require different diets, okay? Some people, keto is really big right now. That's fine, okay? Mediterranean diet, that's good. There's different kinds. There's no one size fits all. There's work from Dr. Gonzalez, who was a pioneer in, as a medical doctor, did a lot of research on diets and treated cancer with diets only, had some excellent outcomes. And he writes on in this research that the amount of stress that people have, he's found to be related to the amount of protein they need in their diet. So in other words, if you're a very high-strung type A person, okay, typically you do better with a higher vegetarian diet. The corollary to that is if you are a type B, more laid back, stress doesn't bother you as much, typically you do better with a higher protein diet. Okay, so, and you can talk to me more about that, but it's a very interesting relationship that when I was in clinical practice, we used to see that a lot with people. Okay, so let's look at basic supplementation. Okay, since many of you watching, we don't have a doctor-patient relationship. I'm not giving you specific guidance, but we're looking at generalities, and feel free to email me and we can talk about more specifics. Okay, we know that for bacteria and viruses, there's a whole host of good components that support the immune system. That's what we're looking at. We don't want to be like medicine and focus on this virus or this bacteria. We want to have the healthiest body that we can, both for you and your family. Okay, we're talking about supplementations. Please throw out your gummy vitamins. Okay, they're making more and more of them, but gummies are not good. Okay, because of the high fructose corn syrup and other starches that are in it. Okay, vitamin C, really important. China's been working with vitamin C. They imported just truckloads of vitamin C, ascorbic acid for their patients or for their residents. Vitamin D, really important. Again, if you can pick up enough sunshine, your body synthesizes vitamin D. If you can't, then go ahead and supplement with vitamin D. It comes in many different forms. Again, vitamin C, we're going back to that. Basic vitamin C is ascorbic acid. You can just use powdered ascorbic acid in water. They have vitamin C with rose hips, all kinds of stuff. There's liposomal vitamin C's. If all you can get is ascorbic acid at this time, take it. Okay, vitamin C lasts in your body, being a water-soluble vitamin, for about 2.5 hours. So we recommend not taking it all at once, but to break that out throughout the day. If you are using ascorbic acid, just mix the powder in water and sip on it throughout the day. It's a good way of getting that. If you're eating a really healthy vitamin, you can skip the multiple vitamin. if you're not eating a really healthy complex of fruits and vegetables, really encourage you to eat a decent multiple vitamin. That goes for your kids also. Okay, a lot of times kids are picky. We need those vitamins and minerals for cofactoring especially within our lower bacterial system. Probiotics, multiple strain, very important. Probiotics vary a lot, okay? Some people work with a better kind of a probiotic. Sometimes it's a trial and error basis. At this point in time, I encourage you, if you're not on a probiotic, take one, okay? If all you can do is do a yogurt, then eat a yogurt a day. But if you can do it, if you can take a higher potency probiotic, again, 70 to 90% of your immune system is in your gut area. So the stronger we can have that gut, the better off your immune system is going to do. Okay, elderberry. There's been varying reports. There was originally a report out of England saying that it creates a cytokine storm. But the research more recently is saying it's really not important, and elderberry works very, very well. If someone is going into a cytokine storm, which is a inflammation response within the body, then you're going to want to stop that. But usually at that point, you're going to be in the hospital anyway. Zinc, usually a small amount of zinc is very good, works with a lot of the immune function, as well as nano silver, again. So these are the main ones. There's lots of other little ones you can point to this particular study or that particular study, but looking generally, these are the ones that seem to work out the best. Now, children, you say, okay, how much does a child need? Well, there's some differing opinions, but a good rule of thumb is kids that are 14 years and older, same as the regular dose. So 14 and over, adult dose. Ages 10 to 13, 2/3 of an adult dose. Ages 6 to 9, half the adult dose. And ages 2 to 5, about a quarter of the adult dose. Okay. Now, if you start having the symptoms of COVID-19, just like symptoms of a flu, then you're going to want to significantly increase that. Okay. And we don't want to be going by the RDAs. That's a level just to stay alive. We want to go with levels that are going to be more therapeutic. Okay. And if you send me an email at info@goodmedicinefh.com, we'll get back with you with more specifics. Okay. And include your family, ages, and any particular chronic health conditions. Okay. Now, another area that is I believe, going to have a huge impact down the road is genetic testing. Okay. And we're about 92% of us are about the same. And this has to do with disease susceptibility, drug and natural supplement response. We all have genetic errors called SNPs, and that's a fancy abbreviation for a single nucleotide polymorphism, okay, called SNPs. And we have over 12 million locations on our DNA, okay? And they contribute to what makes us unique. Now, our genes and SNPs are unchangeable, but they can be influenced by environment and lifestyle and nutritional factors. This is called epigenetics. This is one of the coolest things. So a parent has diabetes, okay? We find that you have an increased risk of diabetes based on your DNA. What we can do is, based on that, we can tell you what you can do to work at preventing it. Okay, so the epigenetics is how you prevent issues. Okay, and that is just so exciting. Neurodegenerative conditions, all these different conditions, and now we're actually able to test infants, children, and adults, and we only test them once because your DNA and these SNPs do not change throughout your life. We can load the information up 10 years down the road. You're struggling with another condition. We can load that up and then tell you what you need to do at that point in time. And it's just a simple cheek swab, so it makes it easy for any age. But the information, this is literally the cutting edge of personalized healthcare and personalized medicine. So you're going to be seeing a lot more about this coming down the road and how it affects our immune system, because we have SNPs that affect how we function. So if we have a particular SNP that says that you do not produce enough vitamin D, because vitamin D is a huge system, or that you have a low zinc load, okay, well, for the rest of your life, you're going to have to increase that to keep that system functioning the way that it's supposed to. So I'm so excited about this. And like I say, we'll be sharing more information as time goes on. So the bottom line, okay, it's COVID-19 this year. How it got blown up proportion, I don't know, but it's here, okay? We're always going to have a next pathogen, okay? A new virus, bacteria, et cetera. We're going to have to fight that. And so the stronger we can keep our immune system, the better position you are to fighting off anything. Now, people that have autoimmune conditions, which I know some of you do, people that have certain heart conditions, no, you have to be extra careful. And then at that point, there's other things that you can do to help prevent as well. And one of the things, looking at the genetics, that can help down the road as well. So I'm super excited. Personally, I'm not fearing this at all, because I just scour through the data literally every day to see what's out there. If you look at the age rationing, most of you are in good positions. I know I've talked to some of you specifically with the chronic health conditions. And so we're just praying that that you stay strong. And so that's the bottom line.